ORS for babies, benefits and how to prepare it at home. ORS, oral rehydration solution, is a solution of oral electrolytes given to dehydrated children due to diarrhea and vomiting. It contains a mix of sodium, potassium, sugar and other important electrolytes the body needs. When does your baby need oral rehydration therapy? Most minor dehydration cases don't need medical attention and can be treated with breast milk, water, formula, and diluted juices. Severe dehydration cases caused by diseases, such as viral gastroenteritis, also called stomach flu, need ORS for treatment. Benefits of oral rehydration solution. ORS can be used to avoid dehydration proactively. Studies have shown that it is safe for all age groups. ORS is self-administered, does not require injections or food transfer, and gives results within minutes of consumption. What are oral rehydration salts available as? You can easily find oral rehydration powder or pre-mixed bottles available in pharmacies. How to give ORS to infants. Pour the ORS powder into 200 ml of boiled and cooled water. Stir well until the water turns slightly cloudy. Do not mix ORS in juice, milk, or any liquid other than water. Give your child the ORS in small and frequent amounts using a spoon, feeder or dropper every 1 or 2 minutes throughout the day. Do not use the leftover solution the next day. Make a fresh ORS solution every 24 hours. What quantity of ORS your child requires? Children under 2 years of age, 50 to 100 milliliters, a quarter to half a large cup of fluid. Children aged 2 up to 10 years, 100 to 200 milliliters, a half to 1 large cup. Older children and adults, as much fluid as they want. How to prepare ORS solution at home. Add 6 teaspoons of sugar and half a teaspoon of salt to 1 liter of boiled and cooled water. Stir until fully dissolved. What to do if oral rehydration salt is not available? If ORS cannot be available at the chemist or home, rush your child to the pediatrician or the hospital.